absolutely thrilled to be included in this fantastic inaugural conference and to be representing the Bonnie Wesorick Center for Healthcare Transformation at GVSU. I want to start by just sharing personally that I was motivated to relocate to Grand Rapids about 10 years ago from the East Coast. Because upon my first visit to Grand Rapids, I was so inspired and impressed by the innovative thinking and ideas around how healthcare had to evolve, how we had to do more to help our community, not only in times of sickness, but also in times of health. So I accepted a strategic role with Corewell Health to help them do just that, add health to healthcare. So as I stand here today, 10 years later, I continue to be so impressed and inspired by all that has and is happening in West Michigan to create a better way to deliver healthcare and to do more to help our community be their healthiest selves. So Nate, as you alluded to earlier, I also am really excited by everything that's going on in Grand Rapids and also excited to see this conference evolve. So my background in training in behavior change science, I leverage that to help develop programs and products all around health optimization. So with my entree into healthcare about 10 years ago, I was able to marry that passion with the emerging fields of culinary and lifestyle medicine. So today I'm excited to share more about those fields with you. I began 10 years ago by helping to build a new department in medical specialty and culinary medicine program at Spectrum Health. And now I'm excited to be advising and supporting and equipping health systems and startups around the country. And I'll even share some examples around the globe, both through my role with the Wesorick Center and my role as a consultant. So I'm going to be sharing today specifically some key aspects of culinary and lifestyle medicine that make them so powerful, and that is interdisciplinary care and digital connectivity. That to work. So if we could just jump right in, perhaps. I think the crux of the challenge of delivering whole health care is what has already been alluded to this morning, which is that our traditional healthcare system right now is critical, as has already been mentioned, like everyone else. I want to be able to rely upon the best healthcare system in times of sickness or emergency for myself or my loved ones. But right now, that structure is, for the most part, brief episodic appointments that are within the walls of a healthcare system or within virtual care. And our lifestyle happens in the everyday moments of our life. That is far away from the walls of a healthcare system or the purview of a traditional healthcare system. I think that basically every clinician or provider and most of our general public would agree that a huge contributor to our health is our lifestyle. How much we move, what we put in our bodies, how well we sleep, how well we manage stress. But yet, our medical training and healthcare training spends very little time on building foundational knowledge and skills to actually counsel and bring lifestyle into the forefront. And us as America, especially in America, we also don't do so well on our own to optimize our lifestyles. We often know what to do or what would be helpful. But we are surrounded with continuous social norms of unhealthy habits. We might get kind of a jump start and be working on our health, but around us what we see are lots of other people having fast food or pizza for lunch daily. We think, you know what, I'll just have dessert tonight, and then our bedtime or nighttime snack leads the next morning to our high sugar lattes or our energy drinks. And we just get in this loop of, because it's what we see around us, of these unhealthy habits. And in fact, this problem is worse than we tend to really even consider. In this large national survey, it was found that less than 3% of Americans get kind of minimum recommendations for movement, have a decent quality diet, have a body fat percentage within a normal range, and avoid tobacco. Less than 3%. This means that basically almost everyone could greatly benefit from whole health care that is, for the most part, absent from our healthcare system. And let's just drill down for a minute into diet. It has, for the last 10 years, been the #1 lifestyle predictor of all-cause mortality. We see these headlines sometimes that our diet is killing us, and it's true, it is a huge concern. We have this, as I mentioned earlier, this myth of moderation. As I mentioned, we see everyone around us living similar lifestyles as our unhealthy lifestyles, and we just think it's the norm, and we get stuck there. So we're in a pretty sad state of affairs, and again, just a few more minutes on diet. When we see how much our society is consuming processed foods, sugar-laden foods, and how little greens, fruits, and fiber are in our diet, we really see this huge disconnect by how we are eating, which is one of the biggest contributors of our health, and what is needed to really be able to optimize health. And again, with our healthcare system not really structured to do too much to support us in that range. So it's not surprising that we are in an absolute epidemic of diet-related chronic disease stemming from overall inflammation. This is why, this kind of underlying inflammation, that we see so many Americans with multiple chronic diseases. And it's why it's not surprising that by middle age, more Americans than not feel crappy most days, right? Whether it's gut health, or we're carrying around extra weight, or we're battling and managing multiple chronic diseases. There's so much opportunity and so much work that needs to be done. In addition to our healthcare, our sick care, we need to be doing more to help our neighbors, our community members live healthier lives and optimize their health. And also to live their healthiest selves, right? This is not about dictating one vision of whole health or one vision of what your lifestyle should be like. Certainly it's about meeting people where they are, but at least being able to give more opportunity to support individuals in achieving whole health. To quote the food journalist Michael Pollan, "Isn't it as easy as eat food, not too much, mostly plants?" Certainly, if it was this easy, we wouldn't have the chronic disease epidemic that we have. We tend to think of individuals that have a more Mediterranean or whole food diet as extremist, but we've come to just take as kind of the norm that decades of unhealthy eating can lead to blocked arteries. So we have this disconnect of what we think is extreme when we're thinking about how to optimize our health. So with my background in changing and behavior change science, it was absolutely drilled and ingrained in me in graduate school that when we're thinking about helping individuals make meaningful and lasting behavior change, education is necessary, but it's not sufficient. We need to go beyond education, go beyond the few minutes that a provider might be able to speak to a patient at the end of the visit about their lifestyle or some blanket recommendations of what they could do to improve their diet or move more. We really need to be able to provide more to support people in a way that will lead to meaningful and lasting behavior change. Inspiration is a key aspect through role modeling, through stories, through success stories. When we see examples of others who have improved their health, we can, through their stories, imagine and see ourselves accomplishing something similar. Skill building is absolutely critical. We often see behavior change folks, kind of jump all in, go into, all healthy eating or join the gym, certainly at the start of the new year around New Year's resolutions, and then people just trail off, right? They just tend to go back to their old ways of living and give up on that excitement they had about optimizing their health. And what we know is that we need a stronger foundation for behavior change in order for it to be meaningful and lasting. And so much of that is skill building. Not only skill building in the areas of nutrition and exercise and how to effectively manage stress, but also skill building as far as health coaching, leveraging skills like motivational interviewing, and actually helping people do that really important early prep work to prepare for behavior change so that when they actually get to making the change, there's that strong foundation that it's built upon, that it continues to be their new way of living. It transitions from being just a change to their lifestyle, their new norm. And then community. Community is another critical pillar of successful behavior change. Our best efforts at behavior change happen when we are changing in community, when we are with peers who are on a similar change journey and supporting us, and we're able to support them. Thank you. Okay, so how do we take all those lessons from behavioral science and actually add health to healthcare? I'm excited to share a variety of ways, both within traditional health system and within entrepreneurial independent healthcare efforts, that we can incorporate whole health into the ways that we support our communities and our patients. The first point that you're going to hear me come back to many times in the next several minutes that I have with all of you is this critical imperative to have multiple disciplines within a clinical team represented. In order to truly empower individuals to be their healthiest selves, we need to come at this from many different angles and many different disciplines. This idea of interdisciplinary care is not new. This idea of patient-centric collaborative care, where it's not just multiple disciplines working in silos, but rather coming together as a unified team to support patients, has long existed. In the last 8 or so months, leading the Wesorick Center, I have been so grateful and excited to meet Bonnie Wesorick, a visionary nurse leader and entrepreneur who decades ago began really being a proponent for the critical nature of this truly interdependent healthcare system. And it started with Bonnie's work as a graduate student in nursing, as a clinician and a nurse at Butterworth, and then her starting her own consulting business here in Grand Rapids decades ago. Bonnie's work and her inspiration led to the development of the clinical practice model framework. And a key hallmark of this model that was leveraged to help health systems locally across the country and in Canada to accomplish healthcare transformation was interdisciplinary collaboration. This aspect, again, of really having the patient at the center, that Bonnie had this and continues to have this vision that a patient would only need to tell their story once, and that all of the clinicians supporting them would know that story, that it would truly be unified care. And Bonnie and her team, as I mentioned, did a lot of work around the country in helping, by using this model, to help other health systems accomplish transformation, accomplish the best outcomes that they could for their patients. And her work continues on today as part of Elsevier's interdisciplinary care planning templates and guides that are often adjuncts to Epic implementations. And so as I've had the pleasure of spending a lot of time with Bonnie in the last 8 months, some of her kind of comments and quotes really ring true today as we think about what is necessary for effective whole health care. We must break the silos of a disconnected system. Transformation requires great clinical integration across care. Interdisciplinary practice is essential for sustainable outcomes. These are Bonnie's words now, but they were also her words decades ago. And I know Bonnie wasn't the only one supporting or being a proponent for interdisciplinary care. Just really wanted to, really highlight the point that we have come a long way, but we have a long way to go as far as truly interdisciplinary care, particularly with it being so critical for whole health initiatives, whether it's lifestyle medicine, culinary medicine, integrative medicine, or functional medicine. So let's take a look at what does whole health and strong interdisciplinary care and strong digital forward whole health care look like. And let's start with culinary medicine. Culinary medicine is an evolving field of medicine that is really the quintessential example of interdisciplinary care. And it's bringing in fields that didn't often work side by side. The art of cooking and the science of medicine. I think that food as medicine and culinary medicine is much more prevalent in our kind of professional worlds and even just, our national headlines as well. But when you think back 10 years ago, the idea of a chef and a physician together co-facilitating work with the community or work with patients, it wasn't something that we really imagined being possible. And now this field is becoming more and more prominent, both in community-forward ways, consumer-forward ways, as well as being integrated within traditional healthcare settings and appointments. And I'll talk more about how shared medical appointments can be structured to deliver culinary medicine. In case you're not familiar, just a quick highlights on what is culinary medicine. The number one thing is that it is not gourmet cooking. We know there's lots of fun cooking classes that we can take and learn to make, sushi and make homemade pasta, and lots of fun that can happen in that regard. Culinary medicine, though, is truly the integration of nutritional education and medicine and chronic disease prevention and management paired with culinary arts. It is meant to be delivered in a way that food as medicine feels and is accessible, budget-friendly, fun, easy to execute, and probably most importantly, delicious. So we bring individuals into the teaching kitchen or have them join virtual classes from their home kitchen to show them just how easy and delicious good-for-you food can be. If you haven't been part of a culinary medicine class, in addition to kind of what I was talking about earlier, that important integration of education, skill building, community, inspiration, all coming together, that happens as well as a whole heck of a lot of fun in a culinary medicine class. We'll always see almost always a chef paired with maybe a physician or a registered dietitian, working with groups and stations and helping them to make recipes, health-forward recipes that can, range from introductory culinary medicine topics and super easy recipes to progressing to more specific topics like culinary medicine for managing diabetes or for heart failure or pregnancy or weight management. There's a lot of education that happens, even some kind of structured education at the beginning of class, but then that kind of idea of shared learning and your physician and a chef being by your side throughout the class allows for a lot of Q&A and questions along the way, and a lot of just fun learning, not only about the powerful qualities of the food to help fight disease, but also about how to use spices to flavor food rather than relying on salt and pepper, and learning new techniques or learning how to do things with fruits or vegetables that perhaps you've never experimented with in your home kitchen. So, 10 years ago or 9 years ago, as we were doing the first culinary medicine classes in Grand Rapids, partnered with Grand Rapids Community College, it was just amazing to see healthcare brought into the teaching kitchen, so far away from an operating room, but still so critical to healthcare. So our start with culinary medicine at Corbel Health was so well received and successful that we were able to progress to open a lifestyle medicine medical specialty that today continues to be headquartered at the Downtown Market Teaching Kitchen. So a few comments on what is lifestyle medicine before going deeper into some examples of lifestyle medicine. Lifestyle medicine, just even if we haven't heard of it as a medical specialty, it makes sense. We kind of get, just by hearing that term, get a notion of what it is. But I want to highlight that since 2017, it is a medical specialty that physicians and other healthcare professionals can get board certified in to complement either their primary care or other specialty care background. We see lots of physicians from cardiovascular, from emergency medicine, from across the board getting board certified in lifestyle medicine. It is a complement to traditional care. It's not instead of. It's sometimes structured within like a primary care lifestyle-focused practice, or sometimes it's a separate specialty that works alongside primary care and any other specialty doctors that a patient may have. And it's all about bringing lifestyle into the forefront. It's that opportunity and that moments within healthcare that our lifestyle becomes the most important thing for the clinical care team to be supporting and helping us with. As I mentioned, board certification began in 2017. There are now over 7,000 board certified healthcare professionals across the US and 75 countries. We're seeing such rapid exponential growth. We are seeing major health systems like Kaiser and Mayo Clinic, as well as small practices, independent practices, taking on this additional specialty to become better equipped to support patients with whole health. With lifestyle medicine, it is pretty simple in some ways in that the focus are these 6 pillars or 6 key health behavioral areas of lifestyle medicine. It doesn't mean it's limited to just these, but these are kind of the core focus of lifestyle medicine care. While there are some fundamental aspects of all lifestyle medicine care, like it being evidence-based, aligned with the principles of the American College of Lifestyle Medicine, being focused on lifestyle and behavior change, there's also a lot of flexibility in how it's delivered. It can be in person, it can be digital, it can be virtual. It can be delivered one-on-one between a care team and a patient. It also can be delivered and often is delivered in groups or kind of shared medical appointments. So there's also a lot of flexibility. The other kind of key characteristic I want to mention is that it's critical within lifestyle medicine, just like with behavior change, that we meet people where they are. Not everyone is ready to activate lifestyle medicine and make it their primary modality to prevent or manage chronic disease. So we want to have programs and offerings that are for people who are just curious or kind of feel like they should learn more about lifestyle medicine. But what's particularly remarkable is when intensive therapeutic protocols around lifestyle are delivered. The results are absolutely remarkable, and I'll share some more about that. But when I entered lifestyle medicine after about 15 plus years in my career, all working with developing and implementing programs around lifestyle management, I never could have imagined the results that we see with lifestyle medicine care. When individuals are ready to really, and it's often once chronic disease has set on, so they're trying to put chronic disease in remission or better manage it. When individuals are able to really make intensive lifestyle change, their health is transformed. And I'll show some examples that it's not like it takes months, it happens quickly. I want to also just mention that while lifestyle medicine care between a clinical team and a patient is critical, we also really need to think of lifestyle medicine as a broader framework for high-value care. So that idea of, health care that's lifestyle forward is very important. As I've mentioned, it's important that it's multidisciplinary. And even, beyond disciplines that we would imagine would be included, like I've mentioned, chefs and registered dietitians. We also see lifestyle medicine expanding to chiropractors. We actually have in Michigan, in Rockford, the second optometrist in the country that's board certified in lifestyle medicine. And he just offered a class for his patients at Corewell Health just a few weeks ago, bringing eye health into the kitchen. We see some interest within dental care. So this idea of whole team care can really spread to all of our interactions. Imagine how powerful it would be that, in addition to our physician, our eye doctor, and our dentist, and our chiropractor are sharing similar messages around lifestyle and checking in with us and on our progress. That really is game-changing. And that really then would expand to lifestyle medicine being whole system care, where we see it in our workplaces, in our schools, in our community centers, not only just in our hospitals and healthcare. And we do see a lot of efforts happening within employers, transitioning their traditional employee health programs to lifestyle medicine, evidence-based programs. And then this interprofessional care team. As I've mentioned, there's so many different disciplines that can be involved and get involved. A couple that I haven't yet mentioned or said too much about is health coaching. Health coaching is becoming a more common aspect of healthcare. There's still some reimbursement challenges, but we are seeing more and more progress towards health coaches being part of primary care, and they're absolutely critical to lifestyle medicine care. Well Coaches, which is really the premier health coaching certification program in the country, requires lifestyle medicine certification for all of their health coaches. Pharmacist is another discipline that I haven't mentioned yet that's a critical collaborator to lifestyle medicine care. With lifestyle medicine care, we see quickly individuals that are doing intensive lifestyle intervention needing to de-prescribe. I don't know until I was working in lifestyle medicine if I really ever heard or thought about de-prescribing, but people quickly can dial down their blood pressure or cholesterol medicine. So pharmacy is another area that is getting more and more exposure to lifestyle medicine. And then nursing. There's only a handful of programs right now throughout the country that have graduate training that includes a pathway to certification for lifestyle medicine. And I'm excited to be partnering with the Kirchhoff College of Nursing at GVSU to bring that offering to our region, hopefully by fall of 2027. So lots of different disciplines. We need all these different angles and lenses coming towards individuals to help them optimize their health. And in addition to that critical nature of the multidisciplinary, interdisciplinary care, as I mentioned, community is another really important aspect of lifestyle medicine care. And shared medical appointments, this is something that's also not new. We have seen shared medical appointments be stood up in primary care decades ago. But then there was kind of a falling off of them, and we didn't see as much shared medical appointments as we're seeing now, particularly in the last 5 years. And there's a couple of reasons why shared medical appointments are really critical for lifestyle medicine care. One is that patient-centric reason, changing with others, learning from peers, not just healthcare professionals around lifestyle change is really important. Having helped providers facilitate shared medical appointments, I firsthand have seen the light bulbs that go off when patients are talking to other patients, giving each other tips of what worked for them. So there's really real powerful magic in improving outcomes, clinical outcomes through shared medical appointments. But there's also a business imperative with lifestyle medicine. Without pills and procedures and scans, there's limited ways to bring in revenue or reimbursement to lifestyle medicine care. So shared medical appointments create a really efficient and scalable model where a physician and a health coach or a physician and a registered dietitian can see 8 to 12 patients within one 90-minute block or 2-hour block. So it creates a way that there can be enough revenue to sustain lifestyle medicine care. So as kind of the final part of my time with all of you, I want to talk a little bit about another critical imperative to whole health care, and that's digital. As we talked about, or as I mentioned earlier, our lifestyle happens in the everyday moments of our life. Those are moments where we're not standing side by side with a health coach or a dietitian or a physician. So in these everyday moments of our life, when we're trying to implement goals, we're trying to improve whether it's our exercise, get better sleep, manage stress better, optimize our diet, those digital tools are critical to helping us manage and track and know our data, whether it's a Fitbit or an Apple Watch or an Oura Ring, or just simply being aware, having greater awareness of our health metrics. But there's also other critical aspects of digital platforms that can connect that broad clinical care team in lifestyle medicine to patients, that allow communication between patients and clinical care teams that feels more consumer and natural than the messaging feature within an electronic health record, which has a really important place. But again, when we're trying to stay in touch and support and provide ongoing education and skill building and check in with patients and how they're doing with their lifestyle change, this digital connectivity is imperative to keeping that connection between in-person or virtual encounters. I just want to highlight a couple of things in addition to the things you can imagine, like health apps, and Headspace was already mentioned, and as I mentioned, wearables. There's also that critical way in which a digital platform, as I mentioned, can connect a patient to the care team. And I just had an opportunity to write a chapter on digital lifestyle medicine for Oxford Press. And there's 2 platforms in there that I mentioned that I just wanted to call out in case you're curious to look into what are some of these examples of digital connectivity that can support whole health care. One is Rhea, and why I wanted to mention this platform as one example is I think they really just nail that consumer-friendly communication and engagement between consumers and patients and their health coaches or care team members. They leverage AI, and they help for the care team to prioritize the communications that are needed, who to reach out to. There can be data flowing in from wearables and sensors to trigger, someone met their goal, or someone's fallen off and hasn't been getting exercise, or there's some concerning numbers to reach out to, X, Y, or Z patient. But it also just makes it really fluid and seamless for patients to communicate and interact with their care team in between those encounters. And the other one I wanted to mention is Nudge Health, because Nudge Health is not only a digital platform, it's actually also a virtual interdisciplinary lifestyle medicine team with social workers and mental health specialists and health coaches and addiction specialists that are all trained in lifestyle medicine that can be an ad hoc to an internal resources and an internal care team. So we are seeing a lot more creativity. We're seeing a lot greater scale of these types of digital platforms that are critical to connect, the everyday moments of our lifestyle and our health to our whole health care team. As I mentioned, when intensive therapeutic lifestyle interventions are delivered, we see remarkable results within lifestyle medicine. We see biometrics change so much that we actually see that cost of care trend bend and get reduced. Happy to share afterwards if anyone's interested in some specific examples or articles. There's great published research on some of these intensive lifestyle interventions that are great to include in business cases if you're trying to stand up whole health care in a way that you need funding, or if you're within a health system. It was really cool at Corewell when the data that we had used to justify the business case for starting lifestyle medicine, we were seeing those same types of results in person with some of our first patients at the lifestyle medicine practice. It's also phenomenal to see such a wide variety of physical and emotional health areas that are impacted by lifestyle. Not only are people excited when they see those biometrics change, usually their greatest joy is in reporting that they're sleeping better, that they're feeling better. They're feeling better than they had in years or decades. They're feeling more productive, more energetic, more optimistic. We're seeing a lot of work between lifestyle medicine and food as medicine and Alzheimer's and preventing early onset of Alzheimer's. So really fascinating research and just really significant patient improvements and outcomes. I wanted to mention just one intensive lifestyle intervention as one example. Jumpstart is a program out of Rochester, but the curriculum is available to implement nationally. Jumpstart is what's considered is a palate reset program. It's when individuals take a 2-week break from sugar and processed foods. And if you kind of just sit with that for a moment, it's probably even hard to imagine 2 weeks without any processed foods or any sugar or animal protein. It's not a fasting protocol. It is not meant that you have this elimination diet for the rest of your life. It's taking 2 weeks, which most people can imagine doing something for 2 weeks, even if it's really hard, particularly because the Jumpstart program is done in groups. So with that kind of peer group that's in it with you, it's possible. And why this is such a remarkable program is that when we take individuals, particularly those that are entering with obesity or other forms of chronic disease, and they take a 2-week break from that standard American diet, they can have lots of food. They're given recipes to make whole foods approachable and accessible for those 2 weeks. We see improvements that are even hard to believe, even though it's published and on their website. We see on average within those 2 weeks, cholesterol drop by 26 points. And for those who start with cholesterol over 200, on average, there's a 44-point reduction in cholesterol within those 2 weeks. We see similarly astounding results with cholesterol with those that start with high LDL, dropping cholesterol within those 2 weeks by 33 points. On average, people see between about a 5 and a 7 pound weight loss. Again, this isn't meant to be their diet forever, but what we find is when these changes start happening within a few days, by day 5, when the protocol is getting difficult, people are already not only seeing numbers move, but are starting to feel better. So they keep it going through those 2 weeks. And when they see changes that they had been trying to make for years or decades and could never be successful, they see it be successful with dietary intervention at this intensive level, they get hooked. Right? I'm not saying that people stay on a whole food only diet for the rest of their lives. What I'm saying is they leave those 2 weeks motivated, activated, and ready on a different level than they've ever been before. And it's really powerful. And it's through programs like this where we can achieve things like remission of diabetes and reversal of heart disease. One quick example I wanted to provide globally, and it's more of an entrepreneurial startup environment, something that if you're interested in this space, you might want to follow Dr. Nicole Saratin or Institute for Healthy Living Abu Dhabi on LinkedIn just to learn more about what they're doing. But about 3 years ago at a conference, I did a workshop on lifestyle medicine and galvanizing support for lifestyle medicine. And Nicole came up to me afterwards and asked if we could meet coffee. She shared with me that she had this, kind of out there idea that she hadn't shared more too broadly yet, but she wanted to leave Cleveland Clinic Abu Dhabi and start a precision lifestyle medicine concierge practice to really kind of bring to bear all of the tools and competencies needed to really help people optimize their health. And so I have been honored over the last 3 years upon different phases of her work to be one of many advisors helping her. And several months ago, she launched Institute for Healthier Living. And why I wanted to mention this as an example is that it is an outstanding example of the human-powered nature of lifestyle medicine. The interdisciplinary care team that she has ranges from exercise physiologists to registered dietitians to health coaches, physicians, nurses, you name it, chefs. She has that strong human-powered clinical care workforce needed to support lifestyle care. But she also has been able to have enough funding to bring to bear kind of the most sophisticated, at least digital and data informed platforms that I have seen, bringing in genomics and wearables and sensors, variety of platforms that keep the care team connected to patients outside of in-person or virtual interactions. But what's been really amazing is to see, even within in-person appointments with patients, she worked with a team called Cactus to create first of its kind of a digital immersion experience where patients are brought into a room with kind of like, surround screen room, like screens that surround the room that simplified such advanced, enormous amounts of their own data in a way that creates a story of where that patient is. And they use that digital platform to, on the spot, create patient-centered goals that allows the patient to leave the appointment instead of being so overwhelmed by all of the numbers and information, be able to leave with really clear, actionable goals. And then, like I said, those digital platforms in place to support patients in the everyday moments of their lives. Just two final comments as we wrap up. Hopefully you found some new insights in this work. It's a topic hopefully you could tell I'm passionate about, so happy to talk to anyone now or at another time. But just wanted to mention that, as you leave today and you're thinking about your professional work, when we think about healthcare, this kind of, common saying, teamwork is the dream work, but truly we can go so much further today. So just kind of want to ask you all to think about, that interdisciplinary approach. As you're delivering healthcare for those of you that are, what disciplines do you have represented and which others might be helpful to your patients? And then on a personal note, I know firsthand that the life and the pace of a healthcare transformer or innovator is not easy. It's fast-paced. So please also for your own personal health, reflect and realize that medicine is not something we get, but it's something we live. Be sure to be prioritizing your own health and well-being and making lifestyle part of your own medicine. Thank you.